Okay, good afternoon, everyone. This is Cheryl Welbeck, Project Manager for Directors of Health Promotion and Education. Welcome to today's webinar as part of the National Implementation and Dissemination for Chronic Disease Prevention Initiative. Today's webinar is expanding access to healthy food retail and small stores. Today's webinar is a 90-minute webinar, so this webinar is scheduled from 12 noon today until about 1:30 p.m. Eastern Time. And the topic is increasing access to healthy food. Today's presenters are Karen Shore and Juan Vila, both of the Food Trust. I will provide a brief introduction of both speakers today, but before we begin, I would like to give an overview of the control panel that should be on the right side of your screen. There's a control panel that will allow you to do things like raise your hand or submit a question via the chat box or the question box. And if you have issues with audio or visual or something, you can post your question in the chat box and I'll respond to those. I would like to ask you to hold questions for the two presenters until the end of their presentation today. And just to let you know, today's webinar will be recorded. We will provide a link to the recording as well as some additional materials. Probably tomorrow those will go out. So we can get started. Let me introduce today's speakers. As I said, we have Karen Shore, who is Director of Consulting for the Food Trust. Ms. Shore has 19 years of experience in the intersection between program management and public health. She leads an 11-person consulting team for the Food Trust and is responsible for the design, implementation, financial management, staff and team management, and strategic direction for projects throughout the United States, including all healthy store projects outside of the Philadelphia region. Karen also leads the Centers for Disease Control and Prevention Technical Assistance contract with the Food Trust, where she oversees the provision of food access technical assistance to pitch, reach, and national organizations, land grant, university, and tribal organization grantees nationwide, many of which include healthy food retail initiatives. In addition, she has a major 18-month project with USDA Food and Nutrition Service to coordinate with a team of nationally recognized experts from academia, public health, and industry to support new in-store marketing strategies to effectively promote healthier foods to low-income SNAP participants. Ms. Shore holds a Master of Public Health from Johns Hopkins, where she was aligned with the school's Center for a Livable Future, and she has a Bachelor in Arts from Smith College. Ms. Shore is based in Philadelphia. Also on the line with us today is Juan Vila. Juan is a project manager for Food Trust, and he is an expert in healthy corner store program design and implementation, and brings to bear nearly 4 years of on-the-ground experience in Philadelphia's Healthy Corner Store initiative, as well as expertise regarding best practices from his work nationally consulting on corner store projects. Currently on the consulting team, Juan started with Healthy Corner Store Initiative in Philadelphia in 2010 and was the first recruitment and outreach associate on the ground for the citywide expansion of over 600 corner stores in Philadelphia. As a project coordinator for Philadelphia Healthy Corner Store Initiative, Juan was also instrumental in the conversion of over 300 corner stores and was responsible for training new staff, including some of the stars in the Philadelphia regional program today. Since 2013, Juan's worked for Karen Shore in support of the Food Trust Corner Store consulting projects throughout the country, including Phoenix, Houston, Austin, Cincinnati, Columbus, Denver, Colorado, and Appalachian, Kentucky. He's been supporting healthy corner store initiatives in San Jose for nearly 2 years. Juan is fluent in Spanish, and he is based in the San Francisco Bay Area. So Karen and Juan, I'd like to welcome you to today's webinar and thank you for speaking to subrecipients on the National Implementation Initiative. Karen, I'd like to turn the controls over to you.
Okay, thank you so much, Cheryl, for the very warm welcome, and Juan and I are really happy to be speaking with all of you today. We're going to be providing an overview of different approaches for improving healthy food access in small stores. Mostly we'll be talking about today in rural communities, tribal communities, frontier, and of course urban communities as well. Cheryl did such a lovely job introducing myself and Juan, but I'll just invite Juan to say hello at this point.
Hi, everybody. Yeah, thank you so much, Cheryl, for the warm introduction, and it's my pleasure to be here to speak with you all today.
Okay, so a quick background about the Food Trust. We are a nonprofit organization, and we have, we're based in the Philadelphia area, but have been working for more than 22 years in states nationally. Our mission is really improving access to affordable and nutritious food, as well as information to make healthy decisions. And the work that we do kind of spans all of the different places where people can be served or can purchase or access food. And so our goal is to try to promote nutrition education from preschool through adults, and we have programs in preschools through K through 12, as well as senior centers, as well as to ensure that no matter where anyone is buying or obtaining their food, there are healthier choices available for them. And so we have some really wonderful programs in corner stores, in rural grocery stores, as well as running 30 farmers markets in low-income communities in the Philadelphia region. And we've long worked to advocate for better food policies and to establish healthy food financing campaigns in cities and states across the country, and are really excited to be a partner of American Heart Association on the Voices for Healthy Kids campaign. So our corner store work and the consulting work that we do really grew out of our program in Philadelphia. The Philadelphia program that Juan really helped to launch is the oldest and largest healthy corner store initiative in the country, with close to 700 corner stores at this point. And we've been running that program in partnership with the Philadelphia Department of Public Health for 8 years now. But we do a lot of consulting work around the country and even internationally, helping other communities, other organizations, regions, both with strategic planning of what their initiatives might look like, or the best way to meet grant goals in healthy food retail areas, as well as doing training and brainstorming sessions and helping with materials. So really anything from kind of a small tactical project where we might help with one particular component of a program, to really helping design and launch a large initiative, we've supported. And so our work has the benefit of having kind of the practitioner component of running these programs. Juan, for example, on the phone, has that experience in both Philadelphia and San Jose, as well as being in and out of a number of different convenience stores and rural grocery stores really around the country, and seeing both through our own work as well as through the wonderful work of partners and other organizations, what really works well and where some of the pain points and challenges are. So we'll do our best to share some of those with you today. So I actually really there's a bunch of different ways to sort of understand the underpinnings of the work that we do. And this is not a very beautiful slide, but I actually like it as a frame of reference for how we think about the work that we do. So the areas that are in the darker green are, as you see, limited access to healthy food. And for a very long time, those of us working in food access were, really pretty exclusively focused on improving access to healthy foods and beverages. And going along with that, in the next box, are improving, nutrition knowledge, improving the behaviors of purchasing healthier food, and whether it's how kids move through the lunch line and helping to promote their healthier choices in schools, or whether it's in-store marketing in grocery stores to help guide consumers to make healthier decisions. Our work was very much focused on these areas, and of course continues to be so today. we've long had a history, if you look at the light green areas, of being acutely aware of the role of these programs in terms of equity and in terms of impact, economic impact on the community, as well as thinking about how these factors contribute, along with a number of other factors as well as other programming that's happening in those spaces, to community health. I want to call your attention, though, to the areas in orange, which are really emerging ways in the last couple of years that the Food Trust and other organizations have really started to think about the work that we do. And, you know, we've had these stores, I've used Philadelphia as an example. You know, some of the corner stores in our network have been in the network for years at this point and have matured past kind of an entry-level phase. And these are stores that are selling more healthy foods and fresh produce, healthy beverages, have a lot of in-store marketing going on in the stores. And we really realize the power goes beyond expanding access to healthy foods in communities, and really is integrally, you know, associated with these stores being wonderful resources in the community and really being community hubs. And the opportunities that, you know, we have found in partnership with the health department, with hospitals and clinics in the Philadelphia area has really enabled us to kind of take that work to the next level and partner these additional linkages, community clinical linkages. So I think that, and sort of looking at it from a healthcare perspective is sort of one way that we are really excited about taking these stores and using them as a way to think about how we and what our role is in improving the overall health and well-being of residents in need. And it really gets back to thinking about it through an equity lens. So, you know, as opposed to thinking, and believe me, it's hard enough work as it is, thinking about how to add healthy foods to corner stores, but really thinking about what we have here really can go way beyond that. And so I'll talk to you today about some of the community engagement and youth engagement and community clinical linkages work that I think really helps to bolster these programs as well as health and communities. So when we think about healthy food retail projects, we think about all of the things that need to be in place in order for that to work for the residents who are using the store. And there's a lot more going on than is even under just our control. Of course, looking at active design, looking at transportation, looking at housing. There are so many other factors that come into play in terms of, you know, is the store safe to walk to, as just one example. So the store is a place that, you know, people like and trust, and it's a place that's selling food that people want. And we think a lot about the cultural appropriateness of the product, healthy product lists and so on. We created a healthy product menu, for example, for use in the Micronesia, in the Northern Mariana Islands, that had foods on there. You know, we didn't have apples and bananas. We had taro and breadfruit on that list. And so we really want to make sure that the use of these small stores is really able to support culturally relevant foods. We also think a lot about how people want to buy food. Not everybody wants to buy whole produce, you know, so it really depends on, you know, whole produce, whether it's bagged in a way that, you know, each bag of produce costs the same amount, which is a strategy that we use sometimes, particularly, you know, of course, in low-income communities. It really helps with knowing exactly how much you're spending. Grab and go and convenience foods, and thinking about how to do that, but in a healthy way, like fresh cut fruit salads. Of course, having the ability to get to the store easily, and that really comes into play when looking at which stores to target in a community. So, knowing that stores are on bus routes, for example, or are, close to schools. Knowing what to buy when you're there, and that's really where nutrition education and in-store marketing come into play. The being able to pay your grocery bill is something that we might think most about in terms of looking at effective pricing strategies to help minimize costs for the owner so that they don't get passed along to the shopper, as well as looking at things like healthy food financing and how that could support, as an example, purchasing a new cooler so that the utility costs decrease and the store owner doesn't need to pass along those high utility costs through prices of the food in the store. I think something else that's quite exciting that we've just gotten involved with is FINI. So that's the Food Insecurity Nutrition Incentives Program, and that's really for the first time without a special waiver from USDA. FINI grantees are able to explore using financial incentives in a retail setting. And so we have a FINI project in Pennsylvania that's looking at using these incentives in grocery stores as well as in corner stores. And we're also a partner on projects in other cities that are helping in supermarkets and corner stores, and as well as expanding the use of food bucks at farmers markets. And nutrition education in terms of cooking knowledge and how to select healthy food and how to store it and cook it is a important component of this work, of course. So you could think about what is happening in the store from these three buckets. Making it more available, making the healthier food more available, making it more affordable, and then also combining it with information to help support healthier decisions. And I'm going to talk a little bit about each of these three things, both from the perspective of what's happening in the store, as well as how we think about how these elements are supported through other programs and other linkages happening outside of the store. So in the store, in terms of availability, this gets at really thinking about what the selection is, ensuring that it's culturally appropriate, and being aware of trends. Of course, distribution and sourcing are extremely important as well, and that also impacts the price point, which is the affordability piece. It also is ensuring that the store has a place to store these foods and a place to stock and merchandise these foods, and that the store owner knows how to do that. So the store owner knows how to, as just one of many examples, knows how to arrange the produce to help minimize spoilage from ethylene gas. Again, within the store, thinking about affordability now. So really see distribution as key here, as well as keeping the operating expenses low, as I mentioned. Thinking about tying in with promotions and incentives, anything that will help stretch the food dollar, particularly for healthier items, especially fruits and vegetables. But it also gets at doing trainings and helping expand the store owner's knowledge of how to do things like minimize shrink. It includes kind of new ideas like, buyback programs, for example, as a store is just launching to help minimize the store owner's concerns and real experiences with product loss as they are getting familiar with handling different sorts of foods, especially fresh items. And information within the store, in-store marketing is extremely important to help call attention to the new items and the prices of the items, to help promote the items, and also to help guide healthier decisions. We use a traffic light, go slow, whoa type sort of symbolism that to help guide decisions, for example, towards whole grain breads and away from cereals and breads and things with refined flours. But we also have studied and have, worked with programs using other types of nutrition rating systems. And within the community, it's really providing information about what's happening in the store. So, you know, whether that's flyers with the location of the healthy stores, you know, certain events and promotional messages. So now we're going to shift gears a little bit and look at what's happening in the community or outside of the store, really, to help promote the availability of healthier items in the store. And, you know, here clearly it's investing in food stores. So if possible, and, you know, there's funds available, to having a grocery store or a supermarket is clearly the gold standard. And thinking about healthy design, thinking about transportation, thinking about planning and zoning, and all of these things that go into supporting grocery stores, either the development of new grocery stores or the expansion and upgrade of existing stores, as well as how to, you know, kind of anchor that store in the community. So, you know, whether it's near public housing or whether it's near a bus stop, for example. Again, in terms of for the community looking at affordability, clearly, you know, this bullet kind of goes without saying, but I think it's important always to keep in mind, you know, the affordability of food really gets very much back to, you know, viable economies and jobs, and having, you know, the tax base there to contribute, as well as having individuals, you know, have the funds available needed for their grocery bill. SNAP and WIC outreach and enrollment are extremely important to help stretch the food dollar, but also help to alleviate poverty, particularly with SNAP. And funding for infrastructure upgrades, and, you know, through, for example, healthy food financing, really help to improve the affordability of these foods. And really the role of public health comes in the community in terms of helping guide nutritious choices. WIC is extremely important and has been a wonderful partner of ours. I'll give some examples of that. Thinking about, you know, doing nutrition education. We do a very sort of more intensive focus of nutrition education in our WIC stores, for example. And we also are going to be doing nutrition education tied into Healthy Corner stores, actually in the WIC program offices in one of the states in which we're working. So, you know, we've been exploring the best way to kind of get these messages out to the WIC moms. And of course, you know, tying it into school nutrition curriculum wherever possible. And this really, I should have mentioned in the beginning, is really the genesis of this program is our school food work, and realizing that the nutrition education that we were providing in the schools didn't match what was actually available in the community. And, you know, the healthy snack examples and things like that were not actually available for sale in the bodegas that the students were walking by on their way home, and, you know, frequenting once, sometimes even twice a day. So really wanting to link in that way so that the nutrition education messages are consistent, but also using these stores as an opportunity to link to farm to school efforts, for example. So how do we do this? Well, as I just mentioned, we think about access, we think about knowledge, and we think about affordability. And I really just want to say that we, you know, definitely think that the best approach is a comprehensive approach. So I don't think anyone thinks that a corner store effort is a magic bullet that's going to be this, you know, cure-all for food access in a community, but it's an extremely important part of a larger suite of initiatives that help to expand access to healthy foods and also support the health and well-being of residents. Okay, so what are small stores? I think between, you know, Juan's and my photos on our phone, we could probably do a slideshow just on all of the different kinds of stores that you might come across throughout the country. And I've tried to include some pictures of them that will follow. But essentially what we're talking about are often, not always, but often independently owned and operated small stores. They typically have one cash register. Sometimes that, changes a little bit. In rural communities, they may be a little bit bigger. They may be called corner stores, bodegas, mom and pops. In rural communities, they're rural grocery stores or rural convenience stores, general stores. There are chain convenience stores, and actually convenience store chains and convenience store associations are doing wonderful things to change, in a broad stroke, some of the healthy food and beverage offerings, and also the price competitiveness of the healthier items. And then also, there's dollar stores and there are pharmacies. I'm sure that folks know, walking into a Walgreens or a CVS, it used to be, maybe there would be some soup or crackers or something like that that fit into, going to a pharmacy to get, some foods for when you're sick, a little ginger ale. Well, there's now aisles of food in pharmacies, and, large refrigerators are not uncommon, where you can buy milk and eggs and bacon and lunch meat and, frozen dinners. So, thinking about what the new sort of changing food retail landscape and what that means for where people are buying food. So here's a mini slideshow. As I said, we could do a couple of hours on this, but just to kind of give an example of a lot of the different sort of diversity of small stores in which we work, and all of you on the phone are working as well. So here's a very kind of typical urban corner store. This is one of the ones in our network. Looks very similar to a lot of urban corner stores and bodegas. This is an example of a rural convenience store. Often tend to be more sort of standalone stores, and often, not infrequently, really seem very similar on the inside to the urban bodega or corner store. But in a rural area, there may also be sort of additional items for sale, and it's not uncommon to see bait or guns or, other provisions. A slightly expanded version of that is the general store, where like its name implies, in rural, but not even just rural, almost suburban communities in rural states. You have, for example, this one's in Maine. You have stores that sell a large number of items. And so, obviously this is an idea that has been around for a very long time in this country, but the idea is that you can go here and purchase, hardware and fishing tackle and so on, but they also sell food. And they're frequently a stop where people are doing fill-in trips for milk and bread and things like that. This is a gas station slash, pardon the image quality here, a gas station slash grill slash convenience store. This combination, this sort of triple combination where it's the gas station, it also has an attached grill, sometimes with just a little counter or a couple seats where, making up hot sandwiches and things like that. But then there's also some convenience items, is extremely common throughout rural America. So, this one was taken in Tennessee, but there's, whether we've worked in Maine or in Ohio or Kentucky or Kansas, this combination is very common. And I'll talk a little bit more about rural versus urban convenience store initiatives, but the trick here is not forgetting about the grill. Right, so often if you looked at how the food dollar is spent in these stores, it's spent in the restaurant, and restaurant might be a generous term, but it's spent in the grill portion, and very little in the way of grocery staples are purchased. Not always, obviously, but sometimes that's the case. And so really thinking in a creative way about how to leverage what's going on in the grill as part of the overall initiative. So you wouldn't want to just focus here on the convenience foods, for example, but you'd want to think about, well, they have a food prep license, right, because they have a grill. So how, maybe this would enable them to add more produce items would help them minimize shrink. For example, if the onions didn't sell and they were starting, still safe to eat, obviously, but starting to, not look so great, well, they can use them in the grill just as easily, or take bananas that are starting to turn a little bit brown and use them in smoothies. And this is just a typical gas station convenience store that is the combination of convenience store and gas station. And these are extremely common. Well, they're common everywhere. We see a lot of these in the South. So in the South, it's more likely that these convenience stores are sources of food. So people don't just see them as, I'm stopping kind of off of a highway here and I'm picking up a soda. But that they're more likely to be places that people would expect to see, food sold. And I can't tell you how difficult it was to find a picture of a dollar store that did not have a dollar store logo. And this is in Canada, so that's probably, I don't know if that's why or not, but I didn't want to, have a brand here. But dollar stores are absolutely the #1 fastest growing retail format in the country, and they're everywhere. So if you take a map, for example, and of your state, a state you're working in, and you identify where the supermarkets are, you identify where the super centers are, you'll see them largely clustered around urban areas. But dollar stores, it's almost like a homogeneous, series of dots throughout the state. And they have put a lot of pressure on rural grocery stores, but a lot of pressure on supermarkets as well. And so you see as a national trend, and I'll talk about that a little bit more, but you really see a very big investment of super centers and supermarkets, large national chains, into this small store format. So I think the good news is that, corner stores and rural grocery stores are the original small store format, and I think their time has come. This is an example of a rural grocery store. So this one's, fairly big. They vary in size quite a bit. This one is a supermarket. But independently owned and operated for a long time by the same family. This one happens to be in Hiawatha, Kansas. And rural grocery stores are just facing so many challenges, and they face a lot of the challenges that, small convenience stores face in terms of distribution, in terms of, having, because of their size, having just outdated equipment like coolers, for example, that cause their energy costs to really be through the roof. So, it's not uncommon to see a rural grocery store that has a cooler that there's like one person in the entire region of that state who knows how to cobble it together, comes every month on a service visit because it breaks down. The bills are, $10,000 to $15,000 a month just to keep it going, and it costs $2,000 a month in repair bills. And so, these are some of the sort of major issues that the rural stores are facing. Farmers markets, they're not the focus of our conversation today, but I do think they're quite relevant, not just in general, but thinking about how farmers markets, or just the concept of, say, a pop-up produce market, relates to helping to bolster some of the healthy food retail work that some of you may be supporting. So this farmers market operates in the parking lot of this rural grocery store. And this store was almost out of business, this Thriftway. And, Tim White, who's the general manager of this store, was kind of ready to try anything, really, and worked with kind of the local food policy council, and he put his head together with some others in the city, and they thought, well, maybe if we do a farmer's market in the parking lot, it will attract customers. And of course, everyone always thinks that would be huge competition. Why on earth would you put a farmer's market right outside of a store that's selling apples and lettuce and flowers already in the store? And it turned out his bet was right, and it's really, he really credits the farmer's market as one of the key ways that he and the other partners in Hiawatha helped to save that grocery store, which is now a thriving grocery store in the city and the only grocery store for miles. So why are we even thinking about small stores, particularly some of the very small convenience stores? We certainly heard at the Food Trust 8 to 10 years ago when we were, our Director of Nutrition, Sandy Sherman, who conceived of the idea, we certainly heard that we were fairly crazy, and these stores sell nothing but sugar-sweetened beverages and cigarettes and chips and candy, and you should just ignore them, and in fact it would be best to steer people away from them altogether. But what we really realized was people were going there and that they were really part of the daily behavior pattern for a number of people, and there was nothing healthy available in them. And yet it was where a lot of residents were shopping, low-income residents were shopping for food. And recent research has really shown the importance of the convenience store for the low-income population. There's no doubt that the overwhelming majority of the food dollar right now, although I think that's changing a lot, is spent in supermarkets and supercenters. But convenience stores in the low-income population make up a larger portion of that food dollar. So they really are places that people look to fill in their day-to-day grocery needs in between their big shops that may be quite a distance or quite challenging to get to, or both. We really, as I mentioned in the beginning, really think about this from an equity perspective, and we think about the right, everyone has a right to access nutritious and healthy foods, and what it means in a community to know that you live in a place that has your back and that has resources available to meet your and your family's needs. We also know that this is stating the obvious, but I think it's important, these places exist, so they're there already. And in some places that are not going to be able to attract a grocery store operator for one reason or another, these are the stores. This is the only show in town many times. In addition, while a larger supermarket initiative is underway, these stores can help to, fill that gap. And then, as I mentioned in the very beginning, even in a place that has other supermarkets, we want, no matter where you are shopping for food, to have consistent messages about what's normal. So, healthy food isn't something that should just be in sort of one end cap or one aisle of a store. It should be something that no matter where you're going, you can really have choices, free choices to select the healthier items. So really the vision for healthy stores is, of course, offering a good variety of healthy and affordable foods to make it easy for folks to make better choices for both themselves and their families, to really support these fill-in trips, as I mentioned, so that no matter where you're going, you can get some healthy staple foods and produce and so on to help, really to meet a better total diet that's more aligned with USDA's dietary guidelines and the WIC package, to serve as community anchors and hubs and provide these wonderful opportunities for community engagement and these community clinical linkages. Really, to borrow Robert Wood Johnson's phrase, is promote a culture of health and really support the health and well-being of everyone, and never forgetting that these are businesses and that are very important businesses in the community that provide jobs and tax dollars for the local economy. And so wanting very much part of that vision to be supporting these stores as businesses. Some common challenges. I italicized the word some because there are many challenges to doing this work, as I'm sure everyone knows. I wanted to just highlight a couple that come up often. And many of the ones on the urban list could also be on the rural list and so on, but these are some of the ones that sort of bubble to the top as common challenges in this work. So in urban communities, distribution, sourcing the healthier items, it's not uncommon for an urban corner store to be getting its food from a number of different sources, including from a supercenter, where they're buying at retail and reselling. So working carefully on pricing strategies is extremely important, and helping establish a distribution strategy that makes sense for that store. They might not be able to meet the weekly minimums of a broadline food distributor, and so looking at where they're currently purchasing, whether it's a cash and carry, for example, working with that cash and carry to help make it easier for the corner store owner to find the healthier items that meet the requirements of the program. In urban communities, they are often, they're always small stores, right? But in urban communities, they're very small stores often, sometimes, fewer than 1,000 square feet, and, lack point of sale systems. So they don't have easy ways of tracking sales, of tracking, how effective was the healthy snack rack that you put by the cash register. That we don't have a great way of doing that in a lot of small stores. And so from an implementation perspective, it can be very challenging to help the store owner. We've sort of come up with creative ways of doing that, of really helping the store owner figure out what's selling and how it's doing. And they also, of course, kind of have that expertise. But it poses problems from an evaluation perspective. So, how do you track sales? How do you track actual use and intended use and so on in a store that doesn't have a point of sale system? There are sometimes, depending on the city or the area of the city, cultural barriers between owners and shoppers. So, for example, the store, may be owned, have an Arab owner, but have be in a largely Chinese neighborhood. And sometimes the store owner doesn't really know what foods that population would be interested in. And so we found in those situations, doing, kind of resident surveys is so important to help inform the store owner about what the shoppers are looking for. Store selection can be challenging. So you may have thousands of corner stores to choose from, depending on how big the city is. And really figuring out, the question of, which stores are we going to target with our grant dollars? We can't do 2,500. We can't probably even do 500. So which stores do we go after? And that's where I and my team rely very heavily on people far smarter than us who are able to do mapping and really build these, wonderful layers onto maps to look at transportation and location of schools and housing and so on, to really help to pinpoint exactly where the stores might be where you want to start recruiting. Probably going without saying that you're looking in low food access areas, but even in a low food access area, there can be hundreds of stores to choose from. And then this question of depth versus breadth. So is it a city-wide program? If you're looking in an urban area, often there's especially in a small city, there's a compelling reason to really want to include everyone in the city. But then that can make it challenging, especially for a city that's very spread out. Some of the southern cities come to mind, for example, where it can just take a lot of effort to go from one side of the city to another, and it can also be very challenging to kind of maintain sort of a depth of the initiative while having enough breadth. So, do you go for 800 stores that have sort of a light level of intervention, or do you go for 50 stores that have sort of a deeper intervention? And these are some really wonderful questions that can help be answered through an effective strategic planning process, and also the very, critical importance of mapping and store selection. Shifting attention a little bit to rural areas and some common challenges. Distribution is extremely challenging, and all of the same challenges in urban communities, plus the challenge often, especially with fresh food. So the food is getting there, but often in a rural community, the purchasing the food in a retail center and then reselling the food is certainly common. It's also not uncommon for stores to sort of split or to collaborate with a supermarket, for example, might be a strategy. We're doing a study right now looking at some pretty innovative ways that stores and distributors and suppliers have been working with small stores. And funded by Robert Wood Johnson, we're doing kind of a national scan looking at all of the different ways this is happening. And so, for example, having a situation where a supermarket in a town might serve as the distribution point and then split up the orders to go to 5 much more remote rural stores. And so with distribution, often in the rural stores, ironically, local food is kind of a bigger component because these are, communities that are rural communities, and so they are, you're living in and around and with, and maybe are yourself a farmer, a producer, a rancher, and so there's a desire to support your neighbors, and but it's even more challenging to get the fresh food and the local food. It's challenging to get local food into an urban corner store initiative in a big way. And it's even, more challenging in a rural community. It's something that I sort of have never forgotten, but when I first learned about the challenges of getting fresh fruits and vegetables in rural areas, it seems so counterintuitive, but the challenges are so significant because, of course, that food really doesn't stay in the communities. In terms of store use, you have to be really careful here and make sure you have to be careful in urban areas as well. But in rural communities, you often have a situation where the store is just seasonal, and there's nothing wrong with that. I don't want to imply that that store wouldn't be used, but you have to think about it differently. So if it's seasonal, then maybe the focus is more on produce, for example, fresh in-season produce. There are examples of wonderful program in North Carolina where that's exactly the example. You have stores that are used primarily for vacationers. So you may have a low food access area in a rural community, and the store may in fact be in a low food access area, and say it has a gas station and a grill and so on. But if you look at who's actually using that store, it's people driving by that store on their way to their camp or their cabin on the weekend. And it might not, even though the store would seem on the surface as an ideal place to target, you have to balance, is this store really where local residents are shopping, or might this be a wonderful thing to kind of capitalize on from a marketing and promotion perspective, and hey, let's help that store make money and help that store thrive, with the vacationers in order to provide expanded offerings for the local residents. So just some, different ways to think about that. The store owner perceptions of the program can be challenging to overcome sometimes. So, it's not uncommon, and we've certainly experienced it, for store owners to be fairly on board with the notion of some support and business support and business trainings and so on, but are not really interested in being associated with, for example, nutrition assistance programs, some, biases or some concerns about, not wanting to advertise that. We find that more often in some rural communities than in urban communities, where there just seems to be some more acceptance of that from a cultural perspective. Community engagement is both extraordinarily important in rural communities as well as very challenging in rural communities. So it can be hard as well to, for example, if you're doing blood pressure screenings, well, you might have a nurse sitting there all day long and have 2 people come by, who are willing to, get their blood pressure checked. You just might not, you have issues with volume, in other words. And so, and getting the word out, and whether you're on a rural route and people are going 60 miles an hour past Takes an awful lot of balloons to call someone's attention to what's going on in the store, which is very different from someone walking past a corner store in an urban area. And so important to rely on community organizations and community centers like the Y and places of worship. And another piece here, is it may require some more tailoring. So it may be that having the community involved in a way, or at least their opinions heard in helping to shape the initiative. This is really important everywhere that we work. But in rural communities, it seems that sometimes having it plugged in with a message that really resonates, so in that community can be very helpful. So here's kind of a before and after of a corner store. This is actually, I like this one because there's pallets of water, which is different than in some places, but so it's a little bit of a better before, but this is very typical, a crowded, packed aisle with candy and chips and, lots of things like that. And this is the after in one of the fresh corner stores that we were working in, where we did this great project partnering with healthy design folks and planners to think about, how could we build almost a pop-up kiosk. It's a little bit bigger than a kiosk, but that's kind of the concept that's already designed and has signage in it and produce curtains and things like that, and tilted baskets to help highlight and bring together not only the healthy foods, but the messages about the healthier foods. In the store, the basic phases and activities of really any corner store initiative are making inventory changes, and then, kind of depending on what the goals are, the characteristics of the inventory changes, and each of these, changes where, regardless, you want to start small here. Even if you want to end up big, you want to end up with more depth, you still need to start out small as you're making these changes and being respectful of these stores as businesses. And then you add in the in-store marketing piece that helps to identify what's happening in the store and help to identify the stores participating in this larger network. Conducting business training for the owners is such an important part of this program to help the owners develop their own capacity to sell healthy. And conversions, or really this is the infrastructure improvements, and funding for this comes from private sources, it comes from foundations, CDFIs, healthy food financing, extremely important source of funding for, whether it's baskets and shelving to refrigeration. Identification and recruitment, this, helps to, map the areas of greatest need, of course, and then, these are postcards where we, encourage the stores to contact us if they'd like to join the program. Conducting the in-store training. I feel like I went over this, but just, some examples is that this is a, really desirable part of the program for store owners. 99% of store owners, 99+% of store owners want this training. Promotion and marketing, whether they're shelf talkers or, shelf tags, calling attention to the items, identifying the prices clearly of the different items, and helping to guide the healthier decisions are many examples of ways that these marketing materials look. These happen to be our marketing materials that we use in Philadelphia, New Jersey, Pennsylvania, and other places, but they're certainly tailored in other communities as well. These sorts of refrigerator clings and window decals identify the store as participating in the network or being a member of the Healthy Corner Store Network or the Healthy General Store Initiative or whatever the name of the program is in your area. And these are some more detailed examples of the in-store marketing materials. The one thing that I actually want to call your attention to on this slide is in the upper right-hand corner. This is a sticker that we used in Jetro, which is a huge cash and carry in Philadelphia, and regionally as well. I mean, Jetro is a national corporation. And what we did was identify the items that matched to the healthy product list, so that the store owners could go into Jetro and not have to do do nutrition label reading and not have to kind of constantly be matching up what was on our healthy product list, but they were able to easily shop. So you're not just changing the decisions that shoppers are making in the store, but you're helping guide the decisions that the store owner is making in the cash and carry. These are examples of recipe cards, which are very popular. The idea is that everything can be purchased in the store for not too much money and feed a family of 4. And there's hundreds of examples of these. So when we talk about infrastructure investments, they may be just these polypropylene baskets, or they may be shelving units, refrigeration units. The highest cost would be something like a customized shelf solution, or certainly a new point of sale system. But there are many low-cost items like chalkboard menus and things like that that can be used to wonderful effect in the stores. So thinking about what happens outside of the store is often just as important, or even more so in some ways, than what's happening inside of the store in terms of its effect on the overall program. And we think about community engagement and policy initiatives and nutrition education and youth and gardens and community clinical linkages, as well as others. So, National HFFI, Healthy Food Financing Initiative, as well as some state and local funds, make dollars available to support new grocery store development and then infrastructure upgrades in existing stores. And most of the HFFI, certainly National HFFI, but also the state funds, support infrastructure upgrades and have had impacts in both rural and urban areas. I think sometimes, people think that this is, a program to create new grocery stores in urban communities, but in fact, there have been wonderful studies done looking by the Reinvestment Fund and Policy Link and our other partners in this area, looking at the impact of these initiatives on existing rural stores. As I mentioned in the beginning, we've been really privileged for the last couple of years to be a partner with American Heart Association on their Robert Wood Johnson funded Voices for Healthy Kids campaign. And we're the Food Trust serves as the National Food Access Hub, which means we coordinate and support technical assistance for healthy food, financing related programs and corner store efforts. Healthy Store Certification is an example of a policy initiative that seeks to reward stores for good behavior as opposed to limiting stores or punishing stores for bad behavior, for lack of a better word. And one of the benefits of a Healthy Store Certification program is really around bringing together, so you see here we've got tobacco as well. So each community can add in the public health related initiatives that are important to them or part of their grant goals. And so you could have initiatives related to physical activity, related to of course healthy eating, tobacco, alcohol, and reducing health disparities. I mentioned that we're really excited about the work that we've been doing with WIC. We've worked with WIC in a few different communities and states at this point. Our work with New Jersey has been really wonderful. We're actually just today entering year 3. And last year we committed to actually enrolling WIC stores into the Healthy Corner Store program that is a statewide program of the New Jersey Department of Health. and we, added, so, go out and to recruit the WIC stores to join the program. And we also did comprehensive nutrition education lessons and cooking lessons in those WIC stores throughout the entire state. One really exciting development, it may seem small, but those of you with NWA will know that this is no small thing. Indeed, one of the really exciting things that we were able to help support with New Jersey WIC was the addition of, it's just one single checkbox, but boy, what a difference it's going to make, which is in the WIC application itself, so in the vendor application, asking whether the store is a Healthy Corner store. So if a store is participating in the Healthy Corner store network already, the involvement of WIC, they know what that means, and they know that that means that the store has added, healthy food, healthy staple foods, as well as the fruits and vegetables that are part of the New Jersey WIC package, and that there's nutrition education occurring in the stores for tailored for the WIC moms, and so part of the application, in other words, to become a WIC store is that the store is participating already in the Healthy Corner store network. In year 3, which starts today, we are going to be doing nutrition education actually in the WIC offices as well. So we're exploring the best way to do this, both from an efficiency perspective as well as how to best leverage these Healthy Corner stores. And so we're exploring, what kind of lessons work best in the store versus what kind of lessons work better in the WIC office. Lots of different ways to support community and youth engagement. In the top left, I spoke already about nutrition education in the schools. Top right shows the Drink Up campaign, which is part of the national Let's Move effort, really promoting water over sugar-sweetened beverages in the stores. And many of the stores that we work with now promote water as a part of the program over sugar-sweetened beverages. Bottom right is HYPE, which is Healthy You Positive Energy. That's our youth engagement campaign that works throughout Philadelphia and southern New Jersey on, kind of energizing the youth to be change agents in their schools and also in their communities. And working with farm to school and school gardens, as well as community gardens, and helping to connect those to the stores, both as a way for students and folks in the community to have a place to sell their food, as well as doing things like field trips and so on to the stores. Here's an example of some of the in-store nutrition education lessons that we have been doing, and we follow a fairly straightforward lesson plan, and each lesson focuses on a different nutrition message, whether it's about fruits and vegetables or whether it's learning about my plate, whether it's learning how to read the nutrition facts label. There's a recipe that fits along with the lesson, and we always have some sort of small giveaway that's not just a little squeeze ball or something like that, but actually sort of helps to promote healthier eating and cooking at home. Community clinical links is really something that we're really excited about and very proud of our work in this area in the last couple of years, partnering with Lankenau Hospital, Jefferson Hospital, and other hospitals and clinics in the region. We received a grant to do the Heart Smarts pilot, which was taking these Healthy Corner stores. So as you can see, in the background, say the one on the bottom might be kind of the largest example, but these are our Healthy Corner stores that already have the conversions and the infrastructure improvements, and they've really changed over in a large way to sell significantly more healthy foods and beverages and to make healthy the focal point of the store. And we really had some pretty basic questions. We didn't know, would anyone ever step on a scale in a corner store? Would anyone ever submit, to a BMI screening in a corner store in front of their neighbors. I mean, these sound like basic questions, but we really just didn't know. And the good news is, yes. And not only were people willing to get their blood pressure taken, and all of these were done by, I should point out, healthcare staff of the hospitals, nurses and physicians, and physician's assistants. But so it just was wildly popular. So we thought we might do these events, and we also do them at farmers markets. And some people would come by. But what ended up happening is we actually ended up having people come every single week. And these patients were followed and were, obviously part of the importance of connecting with the healthcare sector is to ensure that, the patient data is handled appropriately, and that that the shoppers are, residents who have high blood pressure, for example, are referred appropriately into the healthcare system as needed. But we were just able to reach segments of the population that are almost completely lost to preventive health initiatives that happen in a clinical setting. So the data coming out from this are very new. It was a pretty small sample size, but they sure are promising. And we're looking, we've actually just received funding to continue this pilot. And this is part of what we help other communities figure out how to do as well. Some relevant industry trends, I think I hit on some of these. These happen to be my boys goofing around in a grocery store. But as you can see just from this one photo, this one was taken in Pennsylvania, natural, fresh, our local food are actually trends. They may also be important for a number of reasons and are, but it's a big trend in grocery retail right now and has been for some time and is really growing. Fresh is really seen as the #1 trend, kind of pushing retail growth in the country, and local food and traceability. And what that means is just knowing, which farm it came from is becoming bigger and bigger as well. Grab and go is a very big trend as well. And so thinking about, for certain convenience stores, it may be a wonderful idea to just capitalize on the fact that this is where someone's eating snacks, and to help, shift the purchases toward healthier snack items. Smaller store formats I mentioned are really, there's really not a large national retailer that's not investing in smaller stores. And the sort of health component, so even in a major supermarket where you have an in-store dietitian, where you have, kind of weight loss groups and walking groups that meet at the store and so on. There's wonderful examples of this work and kind of how it all comes together with retail that we try to take advantage of and even lead in a lot of the small store work. So in terms of some best practices for healthy store, small store programs, regardless of whether they're in urban communities or rural communities, is really to have them guided by very clearly defined mission and goals. And the reason I say that is it's very easy to layer onto a healthy corner store initiative, for example, kind of everything but the kitchen sink. This program is going to improve health, it's going to improve consumption of fruits and vegetables, community revitalization, jobs, economy. We want to do economic revitalization and so on. So and all of those are important, and all of those happen. But what you want to keep your eyes on the prize and make sure that you really know how it is that what your initiative is doing. So for example, if you want to design an initiative that's going to address crime or blight in a community, a healthy corner store initiative could be one part of that, but you wouldn't look to that healthy corner store initiative on its own to impact that. That wouldn't make any sense, outside of the context of other, initiatives happening in the community. It's important for these programs to be continually evolving. If a corner store program looks the same 5 or 10 years, into its implementation, it's outdated, and it's probably not meeting the needs of the community anymore, much less the businesses. So these programs continually evolve, but the strongest programs have a very clear way to manage those changes, because the last thing you want to do is every time someone gets a new idea or excited about a new thing to do in the stores is to kind of keep going back and back and back to the store owners and really burdening them significantly with these changes. Convening diverse stakeholders, and I would also include residents with that as well, to really understand what they want and need from the initiative. Speaking with one voice, that doesn't mean that you don't tailor messages about the rationale for the program or what its impact will be, but making sure that everyone is on the same page about how to talk about what you're doing, and not over-promising what's going to happen. It's probably not a good idea to promise at the very beginning stages of a Healthy Corner Store initiative that the store is going to look like a mini Whole Foods in 6 months, because it won't. It's really challenging, hard work to make these changes, and you want to be really careful about having kind of a feasible plan and not, over-promising here. Being extremely sensitive to place, as I mentioned, and engaging the community, and bolstering these stores as businesses in the community, and being very careful. It's, my background is in public health as well, and I could sit in my office and come up with all kinds of ideas and things I'd want to ask the store owners. You can't sell this, and you can't sell that, and you have to sell at least, X number of poundage of this. And that may make a lot of sense here in my office, but it doesn't make a lot of sense in many of these businesses. And the last thing that the community needs is for one of these stores to close. That doesn't help anyone. It certainly doesn't help the economy, and it doesn't help the larger work. A lot of the strong programs also do take direct aim at the distribution challenges and really think very much at the outset about how to effectively manage these. And this last bullet could easily be the first, really considering equity throughout all phases of the design and implementation and evaluation of the initiative. I want to thank everyone so much for having us on the phone, and Juan and I would be more than happy to take questions at this time.
Okay, Karen and Juan, thank you for, Karen, thank you for the presentation. I'm going to wait a little bit to see if any questions are coming in from our attendees today. If you do have a question, there are two ways that you can pose your question. You can either use the chat or the question box in your control panel, or if you want, you can raise your hand and I can unmute your line. So if anyone has any questions, please go ahead and post those in the chat or the question in the question box. And while we're waiting, Karen, one of the types of stores that you mentioned was a dollar store. How often are those a part of Healthy Corner Store initiatives, and generally how difficult is it to get a dollar store to participate in a Healthy Corner Store initiative?
Yeah, that's a really great question, and the answer is not often. I kind of like, but that's probably changing. I think dollar store chains I'm talking about here are have headquarters and are nationally managed, and it's walking into a dollar store and asking the manager of that dollar store to make some changes and join an initiative and start, adding some different items is kind of not too different from walking into a fast food chain and telling the manager on duty that day that you'd like to, change up the menu. So these are tightly controlled in terms of what's on the shelf, where exactly it is on the shelf, what the inventory looks like and the pricing looks like, and it can be really challenging. That being said, and another challenge too, I think about, that would need to be considered is, again, sort of from a public health background, I'm not there's a couple of things that I would think about there, one of which is not wanting to do something that inadvertently caused better access to cigarettes, for example. I'd also want to be very careful about not including in an initiative dollar store like that's right across the street from a family-owned and operated, rural grocery store. And so you'd want to be very careful about kind of competition there. That being said, I think there's some great examples that you could look to for national convenience store chains. You could look at CVS Health. You could look at Quick Trip and their commitments through Partnership for a Healthier America, and some of the work of the National Convenience Store Association, which is doing wonderful efforts to help promote the availability and affordability of healthier items in their stores or member stores, and certainly understand that the time has come for that. I think most dollar stores don't tend to sell fresh produce, and I've always really liked the idea, and we've had that in some places of sort of starting in a way that is non-threatening to the dollar store. So instead of going into a dollar store, again, with very, closely controlled profits and so on, and rearranging everything on a shelf and adding foods that aren't part of their national database and so on, the idea of doing a pop-up farm stand in their usually very, sizable parking lot is a really neat idea that I think would be worthy of exploration. And it's certainly, they're certainly growing and occupying more of the food dollar in low-income and rural residents in this country, that's for sure. So I just think it's careful, like anything else, just careful in the approach, but I absolutely would not be one personally to write it off, and I think it would be actually very exciting to consider partnerships there.
Okay, thank you, Karen. We do have one question that's come in, actually two new questions have come in. The first is, could you describe how the Pennsylvania Department of Public Health worked with Food Trust and Philadelphia corner stores through grant funding? What was essential for developing grant funding?
Sure. So we've been working, as the question implies, statewide throughout Pennsylvania. And the way that works is the funding is is through $1305 grant dollars from CDC, and the Department of Health has different regional contractors that are responsible, for the public health, coordinating the public health efforts in a region. And so the Pennsylvania Department of Health model is actually a really interesting one for us because it's a train-the-trainer model in terms of if you're looking at the Food Trust involvement, how's the Food Trust involved? We're doing train-the-trainer with these RPCs, the regional primary contractors or public health contractors in the different regions of the state. So the Department of Health is contracting with the Food Trust to do train-the-trainer and provide technical assistance. And through this network, we've been able to establish a statewide network of healthy corner stores in many cities throughout the state.
Okay, thank you.
Mm-hmm.
Karen, one of the challenges that you mentioned for rural healthy corner stores is energy costs associated with refrigeration and that type of thing. Typically, how would a coalition go about working through that particular challenge with one of the business owners?
So I would, in that situation, I think it would really be important. There's a couple of different things that can happen. One is energy audits can be done. Often there's kind of a local business association or even the local utility will do energy audits to help identify you know, kind of the particular problem areas, whether it's lighting or whether it's, you know, solar energy through kind of unfilmed windows, whether it's the need for, you know, produce curtains, or whether it is really outdated, you know, these outdated coolers as an example. At that point, coming up with a business plan for, you know, what needs to be done in the store and, you know, what kind of, you know, return on investment, you know, analysis and so on to really support the business planning of a significant upgrade. We often work with CDFIs, so community, you know, development funds, who are really specialized in supporting, you know, healthy food access in stores from this business and funding perspective. And they may have, you know, either very low interest loans or forgivable loans or even grants available. Through USDA's rural development, there are often as well grants for rural grocery stores, you know, and you know, replacing a cooler would be kind of a prime example. So working in that would really mean tapping into kind of the financing dollars that are available through a number of different channels, whether it's through a healthy food financing fund operating in the state, whether it's and or through CDFIs and or through rural development dollars that are available. And I would just say, as it's not really a caveat, but sort of an addendum, the fact that it's available doesn't mean that the grocery store operator is capable or has time, really. As all of us know, writing a grant is not the easiest thing to do, and you know, it can be just very daunting. And there have been, you know, a number of grocery operators and GMs that I've talked to who have, you know, a dilapidated cooler, and there's dollars available in the rural development funds, for example, is one example I'm thinking of. But the application is kind of like buried on the desk, and they just don't have the capacity and the time to complete it. And so CDFIs often offer, you know, support in that area. Local small business groups also offer wonderful support in that area.
Yeah, and there are also a few trainings that you can do with store owners in order to make sure that they're using their equipment efficiently. You know, things as simple as unplugging equipment at the end of the night that's not necessary to kind of reduce that vampire effect from, you know, draining electricity from equipment that's not being used. Also, just making sure any equipment that you provide for the store owner as part of an initiative is ENERGY STAR rated and is really efficient with energy. So, for example, we generally give stores closed refrigeration units as opposed to the open refrigeration units because they are much more efficient with electricity.
Those all sound like really great benefits for the business owners. I did have another question then. How often is the Philadelphia Healthy Corner Store Initiative bringing together the stakeholders, and then how much sharing of data and other resources are taking place with the business owners and other stakeholders?
Sure. So really, it's a very close collaboration with, and there's, you know, just so many different stakeholders, right? So we work really on an almost daily basis with the schools and with the Department of Public Health, and that's a very close collaboration there, both in planning for the initiative as well as, you know, supporting evaluation of the initiative. And in terms of bringing, you know, you question about kind of working with the store owners. Was that your other question? Maybe I'll let Juan field that one. I wasn't exactly sure, Cheryl, what your other question was.
Sure. As far as sharing other resources or incentives for the business owners.
Oh, sure. So,
right.
So the materials that are created for, and I'll answer the question and you can tell me whether this is what you meant, but the in terms of creating the material, so all of the materials that we create are, you know, they're certainly publicly available. We do own the materials, but we don't sell the materials, if that makes sense. So we do, if a funder is supporting the creation of materials, we just ask that that funder be credited. That's really the extent of it. but do support the tailoring of the existing materials that are created and share the materials both online as well as in person through trainings with the store owners.
Yeah, the majority of trainings we do with the store owners are in-store, one-on-one with the owner, just because most store owners have very busy schedules and it's kind of hard to find a common time when they're all available at the same time. So we really try to make it as convenient as possible by going to the store, finding out when they're available, when they have a few free moments to just go through a couple of different items that might benefit their business.
Okay, thank you. Are there any other questions from attendees on this webinar? Just a reminder, you can put your question in the chat box or in the question box. Or if you want, you can raise your hand and I can unmute your line. Okay, I'm not seeing any other questions at this time. We will make contact information available for both Karen and Juan if someone thinks of something later on or has a follow-up question in regards to anything that was presented in today's webinar. Karen and Juan, thank you for a very thorough overview of increasing access to healthy foods via small corner stores and healthy corner store initiatives. Very lovely presentation. Thank you both for your time this afternoon.
Thank you so much.
Thank you very much. It was our pleasure.
Okay, with that, we will conclude today's webinar. Thank you all for attending.